Heavy periods, pain during periods, spotting in between, pressure in the lower tummy, all this can be a features of fibroids. I am Dr. Shilpa Bansal. I am gynecologist practicing at Harley's Clinic in Andheri West, Mumbai. This is one of the major symptoms that we see commonly in the fibroids. Fibroids do not come as one thing that come as like a presenting thing. It has got so many presentations that we see, but most of the time 40% to be specific are incidental. Incidental fibroids are fibroids in which we do a sonography for some reason and then we happen to find a fibroid. Not all fibroids need the treatment. Not all fibroids are symptomatic, and treatment of fibroids are totally directed on the symptoms of the fibroid. So let's just discuss about what are fibroids, how they can present, and what are our treatment options. To start with, fibroids are non-cancerous growth in the uterus which can affect the fertility or which can be there in the uterus without troubling the woman. Few things about fibroid. The size doesn't matter, the site matters. So this is the uterus, that's the fibroid. So fibroid, if happens inside the cavity, even if it is small, needs to be addressed. If it is a big fibroid sitting on the head of the uterus, it might be an asymptomatic, it might be an incidental finding. So not all fibroids need treatment. We have to be very specific that we want the treatment because we are symptomatic, we have any issue because of fibroid, or we are looking for a pregnancy. That would be the reasons in which we can take a option of removing the fibroid. How we can find out fibroid? As I said that we did the scan and we happen to see the fibroids. Sometimes a lady comes with the pressure symptoms that there is heaviness in the lower tummy, frequency in the urine, pressure during passing stools. It can also present as spotting in between, very heavy periods, so much of cramps during the periods. It can also present with the person who is trying to get pregnant and pregnancy is not happening. So fibroid is not one presentation, it can present in a different manner. Diagnosis usually happens by the sonography. In the scan, we can detect the fibroids. Good part, of course, they are not cancerous, but if they are symptomatic, we do take a call on addressing the fibroid. We have various treatment options for fibroids. We can either take the tablets, we can take the injections, and there is an option of surgical way also. We call it as a laparoscopic myomectomy, in which we remove the fibroids. It's a surgical procedure. We generally get the investigations done prior to the surgery, making sure that you are fit for the surgery. What we do in a laparoscopy is we put 4 ports on the tummy, in which we put a camera in form of a tube, a kind of a telescope. It goes inside the tummy. We are able to manipulate the fibroids and the uterus with it. We cannot remove a big fibroid in toto, so we have a machine known as morcellator. This morcellator makes it into a small pieces and we remove it from one of the ports. We give an option of removing of the uterus if it is multiple fibroids and the family is complete. There is an option, we call that as uterine artery embolization, which is a newer advances in which we can thrombose the uterine arteries, supplying the fibroid and also help in the size decrease. If you have any queries about what to do in case you have a fibroid, you can write in the section given below or you can get in touch with Harley's Clinic.